It's a year that I don't think any of us would have ever imagined. It's been full of challenges. It's had its positive moments as well, but it literally started out as a challenge and has remained that throughout the year, with a long list of things: a labor dispute, a protest in the park, Black Lives Matter, defund the police, and those discussions, obviously COVID, and then even from an operational standpoint, when I talk about the overdoses, the drugs, the guns, those types of things in our community, 2020 has been a big year. The number of lives lost due to overdoses now well over 100 in our community. So it is a big, big problem. There's so many factors that play into that. And really it's about, what are we going to do? What do we need to do now and long term as a community to try and dig into and make some sort of sustainable change in this problem? The type of drug that is being done and the impure nature of the drug in our community is definitely part of this. So, you've heard me talk over the years about the problem that meth plays in our community. Meth has become a little bit more limited in supply in our city, and as a result, we're seeing drugs that are a mixture of other drugs being put together, and sometimes it's the combination of that. The presence of fentanyl is seriously what is causing us the biggest concern. We know that fentanyl provides a real risk to the health and safety of the individuals that consume it, and so that has been a big factor in it. But I've heard people speculate that it could be some money that was handed out as a result of the pandemic. I don't know that I can point to that specifically and say that that's what it is. However, I do know that people that suffer with an addiction, who are not by nature often not criminals, but they are literally someone who have a health problem and they're suffering with a severe addiction, having access to whether it's money or drugs is just an opportunity for them to continue to fuel that addiction. And it's a real vicious cycle. And as I said, we have to find ways that we can dig into this, not just long term, but immediately. That we need to focus on some harm reduction that we can do right now in our community to limit further deaths. I think what we have to understand is mental health is something that we all deal with. We all have various different versions of mental health challenges. Some people have better coping mechanisms, better supports in the community that enable them to deal with it. But the fact that even our domestic conflict calls have gone up from on average 17 a day to now 20 or 21 calls a day, I really think that right there speaks to mental health. People are anxious. People are worried. People are frustrated and challenged by what we're dealing with in 2020, the pandemic, the restrictions, the loss of job, the loss of income, the instability in our school systems. And that's not a criticism. I think our schools have done an incredible job, but just this whole dynamic has been so stressful that I really do think it affects the mental health of all of us. People having to work from home is causing mental health problems for people. That isolation, that inability to interact with one another. And so that often will manifest itself in a variety of different ways. So I do think that what we've seen this year in terms of the increase in calls relating to mental health has some direct links for sure to COVID. We've got a lot of things on the go. Obviously, it's no secret that we've got a new headquarters building that will likely start development here very soon. And the city purchased the old STC building, and so we are going to be developing that over the next couple of years. I would expect you're going to see some of the construction start on that very soon. So that, it may not sound like a big deal, but it really is to our police service. Right now, we have police officers and other civilian staff working in about 7 different locations in the city, but we're really not that big of a city or a police service that we couldn't be all under one roof. And so having the ability to have us all together is not only going to save the city a lot of money in outside leasing costs, but it's just going to make us, I think, a more cohesive and better operating service for our community. I think that's going to be very, very positive. So I look forward to that. We continue to make some really positive strides in other ways ways as well. Trying to focus on where we've got resources allocated. So having the right number of frontline resources will always be a focus. And that's something that we're going to be talking with our new board about to ensure that we're resourced in a way that we meet the needs and expectations of our community. That changes so much. I think about my career of 25 years, what the community wanted and expected in 1995 when I started, and what they want, need, and expect today is very, very different. The challenges are different, and so we need to make sure that we're aligned to meet those challenges. And then, I think if you dig into it a little bit deeper, understanding how trauma is involved in things like sexual assaults and domestic disputes, and ensuring that we're doing proper training there. We've got some really good momentum going with other different parts of our community that are a part of our diverse community, including Black in Sask. As a result of Black Lives Matter and a couple of those rallies that happened in our city, we've forged such a strong relationship with this group, and it's going to help us everything from recruiting to even training. We've got a couple of members set up to come in and help train our officers in terms of perceptions and understanding the need for a positive relationship with people, not just of our Black community, but people in all diverse communities. And again, it's about building that relationship. So I'm excited for 2021. There's lots of work to be done, but it's all very positive stuff, and I'm expecting that we're heading in the right direction.